A nonviolent battle to end the private health insurance industry's abuse of our nation is beginning. On September 29th in New York City, October 8th in Chicago, and in cities across the country on October 15th, over 100 people, including patients, nurses, and doctors, will sit in at insurance company offices to demand an end to a system that profits by denying people care and puts insurance company bureaucrats between doctors and patients. The American healthcare system is broken. We spend far more on healthcare than any other nation in the world, yet stand alone among industrialized democracies as the only country that doesn't provide universal healthcare. Why? Because our system puts the profits of insurance companies and their CEOs ahead of the health of the American people. 30 cents out of every dollar spent on healthcare in America goes to insurance company profits and administrative waste. 1 out of every $700 goes to one CEO alone, Stephen Hemsley of United Health Group, the largest insurance company in America. While he jets off to his new multi-million-dollar vacation home, millions of Americans have no health insurance at all, and tens of thousands, like Natalie Sarkeesian, many who have health insurance, die every year because they can't get the care they need. Natalie died at 17, while her parents pleaded with their insurance company to cover a life-saving liver transplant. These insurance companies ration care in our country, and they do it based on one thing: profit. They are the real death panels that hold the health of our country hostage. The American people deserve better. That's why we elected a new government with a mandate for change, and yet, healthcare reform, even the poor compromise of a weak public option, is in jeopardy. Real reform, Medicare for all, a national single-payer plan, has been nearly shut out of the entire debate. The insurance companies and the right-wing elite are spending millions to kill reform. They spread lies, fund scare tactics, and bribe our elected officials with campaign money. Teabagger town hall disruptions and ridiculous lies about government death panels that are going to pull the plug on grandma have grabbed the headlines and poisoned the debate. And too many politicians, Democrat and Republican, are standing against reform on the side of the insurance companies that fund them rather than the people who elected them. Many who believed our chance to win universal health care had finally come are losing hope. But now is not the time to turn back or give up. Candidate Barack Obama told us, change is never easy, but the story of America is one of ordinary men and women who struggle against the odds to achieve it. The historic election of 2008 was a big step, but our votes were not enough. The fight is not over. Years ago, the civil rights movement faced a similar challenge. Federal reform legislation to end segregation was blocked by entrenched interests. Even Martin Luther King Jr. was losing hope for political progress. Then a small group of students changed the course of history. They entered diners and stores where they could shop but couldn't eat because of the color of their skin and simply sat down. They were dragged out and arrested, but their action unleashed a firestorm of nonviolent sit-ins across the South. The students' deep personal sacrifice dramatized the brutal reality of segregation, moved the conscience of our nation, and inspired a movement that went on to win federal civil rights legislation. We have to do the same thing for the civil rights movement of today. It's time for a campaign of nonviolent civil disobedience to win reform that guarantees the right to health care for all. So beginning on September 29th in New York City, and continuing in Chicago on October 8th, and in cities across the country on October 15th, over 100 people will put our bodies on the line to take the fight to the real villain in the healthcare debate. Patients in need of care, nurses, doctors, and people of conscience will enter the offices of the major private insurance companies and demand that they cover the care they have denied to their members. We won't leave until they do. We'll tell the media that we're coming beforehand, and if they won't even let us in, we'll sit down at the front door. Either way, the companies will have to decide. Admit they're wrong and stop denying care, or have us arrested and show the world how far they will go to protect their obscene profits. If we are arrested, we will embrace it and go to jail, and some will refuse to give our names and be released until the insurance companies meet our demand. Imagine, with the whole nation watching, people across the country willingly going to jail and even staying there because private insurance companies refuse to cover the care their members need. Our actions will put the healthcare reform media spotlight where it belongs, on the problem. We hope that we can save the lives of some of the people who are being denied critical care for life-threatening conditions today. But we know that we can save the lives of millions of people in the years and decades to come by dramatizing just why our healthcare system is broken and demonstrating the fierce urgency of fundamental change. It only takes a small group of people to do a sit-in in your community. But for every American who has been abused by the insurance companies, our example will give them a way to stand up to them, and we will call on them to follow it. Just as the students sitting in at lunch counters galvanized a movement, our sit-ins can inspire everyone who is losing faith in the fight for real healthcare reform to act with new hope. This campaign of nonviolent civil disobedience will continue until the insurance companies no longer stand between the American people and the healthcare that is our right. We will go to jail to demand that they stop denying care to their members immediately. But through our sacrifice, we will speak beyond them to the conscience of our nation and call on our fellow Americans to demand real reform, Medicare for all, that ensures once and for all that every one of us gets the health care we need. Already, patients, nurses, doctors, and people just like you are signing up to be one of the 100 ordinary but courageous people who will launch this nonviolent battle to end private health insurance abuse and win health care for all. Now we need you to join us. We can't wait any longer. Every day more people die because of the insurance company death panels. Now is the time. This is our chance. Sign up to sit in and join the battle at www.mobilizeforhealthcare.org.